8th. A closer look at the numbers that could determine the next steps for the Pocono's economy. And doctors' offices are opening once again, the steps being taken to ensure patient safety.
Plus, the number of heart attack and stroke patients is down. But that doesn't mean less people are experiencing symptoms. Medical professionals have a critical message to share. And coping with the crisis, how mental health continues to be an important focus this month.
Good morning, everyone. Thank you for joining us live, online, and on air for this COVID-19 weekly briefing. I'm Chris Barrett for the COVID-19 briefing team, now in our 5th week. This week, we again have timely information for our viewers, and we hope you'll be able to share this if you're streaming live on Facebook or on YouTube. We want to thank Blue Ridge Cable TV 13, East Stroudsburg University for partnering with the Pocono Mountains Visitors Bureau to bring you this program. Remember, you can get up-to-date information at our website, poconomountains.com/COVID-19. First, let's take a look at the numbers. This week, we will review our weekly case numbers as well as look at the 14-day case calculation for the Northeast region and then the Pocono Mountains. A target goal for reopening, the red, yellow, and green phases, has been set at having fewer than 50 new confirmed cases per 1,000 population, reported to the PA Department of Health in the previous 14 days. So, for example, an area with a population of 800,000 people would need to have fewer than 400 new confirmed cases reported the past 14 days to meet the target. An assessment will determine if the target goal has been met. While state officials have made it clear these are not the only metrics that they will determine if the area can move from yellow, then green. It's interesting to note the data points to about a month longer wait to reach that benchmark for the yellow phase for the entire Northeast region. While if our 4 counties in the Pocono Mountains are considered alone, we could have the right number of cases this month to qualify for the yellow phase if the statistics hold. Governor Wolf is expected to announce today which counties will be moving to yellow next week, in addition to 24 counties moving to yellow today. Again, this information is at poconomountains.com/COVID-19. Joining us again are the presidents of the Lehigh Valley Hospital, Elizabeth Wise, and St. Luke's Hospital Monroe campus, Don Seiple. Don, great to have you again.
Chris, good morning. Good morning to the Poconos. You know, I've continued to see signs of hope this past week. The number of new COVID-19 cases in our region continues to decline nicely. Over the last 2 weeks, the rate of new cases in Monroe County has been cut in half. And in the Poconos, Carbon, Wayne, Pike, and Monroe counties, the rate has been reduced by nearly 40%. The number of patients being hospitalized also continues to decline, and for the first time in over 7 weeks, we do not have a COVID patient on a ventilator. I have to say, woohoo, this is something worth celebrating. In fact, the number of patients currently hospitalized for COVID-19 is the same as it was over 7 weeks ago when the COVID-19 pandemic began to hit Monroe County. You may or may not know this, but this week is Nurses Week, and it's also the Year of the Nurse in celebration of the 200th birthday of Florence Nightingale. Frontline nurses have embodied Florence's bravery, compassion, and commitment. To all the nurses out there, thank you for your service. It is in times like these that we truly appreciate the work you do. Like all of you, thoughts of returning to normal, or at least our new normal, are constantly on my mind. Elizabeth and I wanted to let you know that it is okay to begin to make your health a priority again. We also want to reassure you that it is safe to come into our healthcare facilities and receive care. I believe our healthcare facilities are the safest places to be. We have been taking precautions to ensure our patients, visitors, and employees are protected from the COVID-19 virus. We are ready for you. As I have done the last couple of weeks, I want to thank all of you for doing your part in masking and practicing social distancing. It has made a difference. Not only have we flattened the curve, but we have bent it. If we continue to practice these simple measures, we can continue to reduce the spread of COVID-19 in our community, begin to return to our new normal, and coexist with the virus for the foreseeable future. This week, I would like to give a shout out to our frontline healthcare providers working in our nursing homes. Many times their work is unappreciated. Thank you for your commitment and bravery in caring for your patients. I want to wish you the best this weekend, and I want you to make a big fuss over all the moms out there. Happy Mother's Day and be safe.
Weeks after closing many of the clinics and medical facilities throughout the Poconos due to COVID-19, Lehigh Valley Health Network and St. Luke's University Health Network are back open for patients, just with a new emphasis on following public health guidelines meant to stop the spread of coronavirus.
There's definitely a new normal everywhere you go, and it includes everybody here at the Lehigh Valley Health Network as well.
LVHN practice manager Joe Panzer showed us around the medical facility here in East Stroudsburg just days after the health network reopened its offices to patients.
We have a couple of signs, one that shows that the room has been sanitized for patients coming in, and then once they leave, when they leave the room, the sign will be flipped.
Panzer explains all the precautions taken to make it safe for the patients and the healthcare staff from start to finish of the visit.
When you come to our offices, we'll ask you to call into the office and let us know that you're here. We'll then have you come inside, and we'll take your temperature and ask you questions related to COVID-19, whether you've been sick, whether you have a cough, whether you've traveled out of state.
While Lehigh Valley health practices are trying to use waiting rooms as little as possible, the rooms are now laid out to maintain social distancing. Many of the chairs that used to maximize capacity in these rooms have been removed.
If you should happen to have to wait in the waiting room for a few moments, we do have chairs separated, so we keep social distancing, keeping everybody 6 feet apart, and then we'll call you into the office and get you into your room.
Blue tape indicates the line where patients can stay 6 feet away from office staff, whether it's an expectant mother coming for a checkup or someone with family medicine needs.
After every patient leaves, we're wiping down both the patient table, all the doorknobs, doors, countertops, all the things like that. We're sanitizing with our wipes and making sure the room is clean and ready for the next patient.
The same protocols are being followed at St. Luke's Hospital-Monroe campus and its doctor's offices. Dr. Peter Favini still stresses the need to wear masks when visiting the emergency room.
We've developed tremendous processes. So we went to universal masking, so masking us and masking the patients. If the patients show up and they don't have a mask, we can mask the patients. So that really reduces infectivity for the ability to get the virus or to transmit the virus.
Here at St. Luke's, waiting to be seen by a medical professional has changed as well. For one thing, there's more space available as there are fewer people seeking treatment. And
then we really have spaced out any kind of waiting. We try to bring people right back to a private room and they're in a separate room by themselves, but we try to space out any waiting. We've even had people who preferred to wait in their car. We would call them in once their room was available.
These doctors, nurses, and medical staff still offer visits by phone, but are now offering face-to-face visits in order to provide the best care possible, while staying on top of the latest guidelines to keep everyone safe. Jim Hamill for the Pocono Television Network.
Thank you, Don. We're thankful to have a return to face-to-face visits for so many who need to seek medical care in the Poconos. Elizabeth, always great to have you here. Can you update us on what's going on in your world?
Yeah, I'd be happy to do so. So thank you, Chris and Don. And I also do want to echo Don's sentiments and wish a happy Mother's Day to all the mothers out there, including my own, who's in Florida and would love to be back in her home in Delaware. And also just thank you for the many sacrifices that you've made during the years. So it's a pleasure to be here. As I announced last week, starting May 1st, Lehigh Valley Health Network began reopening more than 50 physician practices and select express care locations across the region. As part of that shift, there are specific steps we're taking to make our offices and healthcare centers COVID safe when you receive either elective surgery or visit an LVPG practice. Specific examples of those actions will be highlighted later in this program. I'm also pleased to note that Lehigh Valley Health Network has returned to 70% of pre-COVID patient numbers, demonstrating the confidence that our patients have in our updated approaches, as well as their commitment to prioritizing your health. In fact, since May 1st, there have been over 3,221 visits at all of our physician practice locations, including the Poconos, which includes in-person and virtual visits. And if you would allow me to do so, I'd like to provide a personal example that I did get consent from my husband to share with you. He recently postponed a test that needed to be done for his health, and this week re-entered Lehigh Valley Hospital-Pocono for the needed testing that he had been putting off. I'm happy to report, because I did ask him how did it go, how impressed he was with the process from start to finish, how comfortable he was, how safe he felt, the explanations that were offered by the technician performing the procedure. So we treat everyone that we care for who walks through our doors like family, yet really this was the most literal of terms. It certainly also helps in moving forward this new normal for routine patient care, as COVID-19 cases are flat or declining in Monroe County. And the trend that we're seeing at Lehigh Valley Hospital-Pocono is a significant decline in the number of patients that require critical care services, as well as medical care. And the number of patients that are coming in for potential symptoms are testing negative. So truly it takes a village to realize these COVID-19 patient successes. A critical part of the team are our nurses. And as Don described, this is Nurses Week and National Nurses Week, and it is the Year of the Nurse. It ends on May the 12th, Florence Nightingale's birthday. So I'm not sure if many of you know, but I am a registered nurse and have extraordinary pride in the level of professionalism that our Lehigh Valley Hospital-Pocono nurses provide to their patients every day. That professionalism has never been more evident than during this COVID-19 global pandemic. One example of these amazing professionals going above and beyond is during the treatment and caring of Bill Cohen, a 101-year-old patient who celebrated his birthday at Lehigh Valley Hospital-Pocono while combating COVID-19. In this video, you can see the nurses and other healthcare professionals lining the hallway, wishing Bill a heartfelt goodbye as he was discharged from the hospital. Bill's granddaughter was quoted as saying, "The medical staff at Lehigh Valley Hospital-Pocono are the most awesome superheroes around. They were there for him when I couldn't be and treated him as if he was a member of their own family." And that is this week's example of my ongoing hope that I continue to share with you. As mentioned by St. Luke's, Don mentioned during a prior broadcast, viewers should not delay in getting needed emergency treatment for critical issues, such as heart attacks and strokes. And in this next segment, both St. Luke's and Lehigh Valley Hospital physicians highlight why this is so critical. This segment also details common warning signs for heart attacks and strokes.
Due to COVID-19, emergency rooms and medical facilities aren't busy like usual.
We've seen a lot less patients come in to the hospital for any reason.
There's especially a drop-off in patients with stroke and heart attack symptoms. But that doesn't mean there are less people experiencing these emergencies.
We have to conclude nationally that patients are either afraid or hesitant to come into the emergency room.
Doctors with St. Luke's University Health Network and Lehigh Valley Health Network agree that people should not be afraid to seek in-person treatment.
The number of infections in the hospital and in our community has gone down in the last couple of weeks, which should make people more comfortable to come back and get treated appropriately.
Especially when minutes, even seconds, count.
Every one of our emergency departments are here to treat other disorders besides COVID that can be just as deadly, that can be just as crippling.
Signs of heart attack may include chest pressure or tightness, trouble breathing, or sudden sweating. Signs of stroke may include weakness in one side of the body, trouble talking, and blurry or loss of vision. These serious symptoms cannot be ignored or treated over the phone.
It will be impossible just by talking to someone to tell if their chest tightness is due to COVID-19 or due to a heart-related issue.
Medical professionals want to assure you hospitals have many additional precautions in place to ensure safety. For example, everyone is pre-screened at the door for COVID-19 symptoms, and COVID-positive patients are kept far away from everyone else.
I do think that it's going to be normal again, but it's going to be a new normal. It's not going to be like it was before, where you go to a doctor's office and you're in a waiting room with 40 other people. It's not going to happen.
For Pocono Television Network, I'm Brianna Strunk.
Thank you both. We'll be joined by some panelists with mental health advice a bit later in the program to discuss how to cope with COVID-19. First, I'd like to share an update on where the tourism industry is with respect to preparation to reopen to the public when the time is right. We have put together an operations task force made up of business leaders, point people at various properties with the goal of being prepared to implement the necessary policies and procedures in accordance with state and health guidelines. The Pocono Mountains Visitors Bureau has created a website that provides resources for reopening the Poconos. It's at poconomountains.com/reporting. There are printable posters, guidelines for various types of businesses, as well as information on personal protective equipment, or PPE, and disinfecting and cleaning. The task force has developed something called the Pocono Promise, which will be our pledge as a region and each individual business to abide by these public health guidelines and exceed them. More on that next week. Now, coping with COVID, you and your mental health. This is Mental Health Awareness Month, and last week we had 4 panelists help us understand some of the ways we can help ourselves get through a very difficult time. Today we welcome Dr. Patrick McMunn, Professor of Psychology at East Stroudsburg University, and Valerie Case, MS, Sales Manager at the PMVB, also has a degree from Moravian College in Psychology and Sociology. Well, it's so great to have both of you here today. Last week we really didn't commit as much time as we should have. So, Pat, I'm going to go to you first. What is your concern now with COVID-19 and everybody just sheltering in place here in the Poconos? What are your concerns?
Well, first of all, thank you for having me here, Chris. One of the things that I'm seeing in my practice as a therapist and amongst my students is this almost failure to, feelings of failure that they're not meeting the status quo. We're constantly bombarded by social media and television of what we should do, and they're great tips and tricks for people that are able to follow them, but sometimes it sets an expectation that people feel like maybe I'm not doing what I should be doing. Maybe I'm not cooking, maybe I'm not caring for my kids and teaching them enough. Which really wreaks havoc on the person's self-esteem. So what I do with my clients and my students is teach techniques called mindfulness. And basically what that is, it's a mental state that's achieved by focusing one's awareness on the now, on today, on what they're feeling and what their thoughts are, and even some of their bodily sensations. But above everything else, I mean, it's a really long technical process and it takes a lot of practice, but at a very basic level, it's teaching people to just take pause for a moment and be aware that they've lost something. Maybe they've lost connectivity to family members and friends. Maybe they've lost a job or an income. Maybe they've lost liberty. They're not able to go out and do the things that they wanted to do. And these are very sad things for people. So it's very similar to people that experience a loss of a loved one. So taking a moment, if it's a couple extra minutes or maybe an hour extra in bed just to relax and allow yourself to feel sad is part of the healing process to moving towards acceptance, which is where we want to be when dealing with any kind of loss.
So Pat, we have Valerie here. So Valerie has 2 children, wonderful, beautiful children, by the way.
They are.
But and you have a background. You were a caseworker for many years.
I was a caseworker. I ran a crisis residence for many years. Yes.
So what struggles have you really encountered in anything that Pat has talked about?
I think similar to what Dr. McMunn said was we're comparing ourselves, especially the moms. We're on Facebook, we're on Instagram, we're on Pinterest. We're seeing all of these moms doing these, amazing meals, and they're putting together these craft projects for their kids, and some of us are just barely holding it together while we've taken on additional roles. So now we're trying to be mom and friend in some circumstances and
And
teacher.
you're working too, right?
And a lot of us are still working as well. So trying to balance all of those things and having that acceptance of this is our normal now, and we're doing the best that we can in every moment. And I think that's the message that we as parents can really role model for our children, is just continue to show them that we're doing the best we can in each moment. Because for them, our kids don't have the same emotional and rational capacity that we as adults have, hopefully. So we really need to be that role model for them to help them understand that there are things to grieve right now. They don't have their friends, they don't have their teachers, they don't have that routine that they're used to having every day.
So Pat, you talked we've heard this a lot, the new normal. What do you think that's going to mean? What does that look like 3 to 6 months from now?
Well, it's hard to say. We don't know. We're encountering new challenges each and every day, and for some people, and going back to that loss, it comes out, if it's unchecked and not managed, it could come out as opposition. We're seeing that in the news, people protesting, because anger comes out sometimes too. So it's important to be aware of what is healthy and unhealthy functioning. Sleeping in a little extra in the morning is okay, but are we sleeping all day and shirking our responsibilities as for teaching our children or caring for ourselves or our jobs or making our situation worse?
So what about the goals? I mean, Valerie talked about so many things that she has to do during a day. Should she set goals? Like, what advice would you give her to kind of get through that day?
Goals are always good to have. Of course, we have, going back to the mindfulness, if we don't meet those goals, are we going to forgive ourselves? And that's key to it, being realistic in our expectations. And we could talk a whole segment on goal setting, but as long as we're realistic and it's measurable, and we allow ourselves a little bit of freedom to not meet those goals once in a while, that's healthy too.
So what about you, Valerie? How did you feel when this first started versus how you're feeling now?
Well, if I may touch a little bit on what he said, and then I'll answer that.
Go ahead, please. Yeah.
What we use in our house is called rhythm. So as opposed to having a very rigid structure or routine, especially for the type A personalities of the world who like to have the schedules and the posters and the checklists, that in the beginning was me. I had all of the things that I was hanging up, all of the checklists, all of the structure, and I realized it just wasn't working for us, and we needed to create a way to function. So we use what we call rhythm. So maybe sometimes we spend a little more time on one activity and a little less on others. Just depends on what we're feeling in that moment, what's working in that moment, and we've just realized that our days can be more fluid, and we're ultimately going to get everything accomplished if we're working together and towards that same goal.
So your students, I've been curious about this, my son's in college now, so he's 20, and my daughter's 16 in high school, and I know you're actually being a teacher, they're distance learning. So how do you feel about that as a professor yourself?
Well, it's required. There's a lack of options as far as getting out and sitting next to your fellow students. I can say that we are adjusting every day and trying to figure out ways to make it more interactive. For me, I use video conferencing. I have students do presentations and evaluate each other via Zoom or whatever product I have. So yeah, just working with the tools that we have, similar to kind of keen in what Valerie said. Use the tools that you have and be flexible and be creative and try and make this a good experience for everybody.
How are the students dealing with it? I wonder that in the college level and the high school level.
Some are persevering. They're doing great. Others, they're trying to figure things out. This was not ideal. I personally had a lot of students this past semester that swore they would never take an online class, and they were thrown in the deep end on this. So
I was wondering about that.
Yeah. So back to that loss thing, they felt like they lost, and some of them were really angry about it. I think for the most part, the majority of them persevered and did what they needed to do to get through this.
So we have about 30 seconds left. And what do you feel somebody can take away from this experience as a positive, and how should they build on that?
Being creative, finding creativity and using your resources around them. At a basic level, we are in survival mode and figuring out what we have, and taking an inventory of our surroundings and our feelings and our thoughts and even our connections, and using them to make better decisions and get through this together.
Well, I want to thank you both, Valerie, for being a real life example. Doctor, thank you so much for being here. This is a segment I'm sure that can go on for hours, and we do want to have some of you back at some point in time to do an extended segment, because I think the mental health piece is one that we really need to explore more on this program and on successive programs. So you're watching the COVID-19 weekly briefing here on the campus of East Stroudsburg University, brought to you by the Pocono Television Network and Blue Ridge Cable TV 13. We want to thank Kim Bell, the general manager of TV 13, and Zach Booth. An additional thanks to Kurt Burton from ESU and our crew here. We appreciate everything that they do for us. You can also watch this live, streaming on YouTube and afterward on PoconoMountains.com/COVID-19. We'll be back next week with more guests and more updates for you. Before we go, a new segment this week. We asked our friends and neighbors a simple question. What was a good thing that happened to you last week? We hope that you find it as interesting as we did. Remember, when you encounter a frontline hero, say thanks, as they are risking their health for us every day, in both good times and right now bad. I'm Chris Barrett. Thanks for watching.
We had a patient down at the hospital that I got to be part of the celebration. He turned 101 on Sunday, and he came into the hospital, wasn't feeling well, was diagnosed with COVID-19, and he was released. And so we lined the halls and sang happy birthday to him. The staff asked him what kind of cake he wanted for his birthday, and he said he wanted ice cream cake, so we made sure he got an ice cream cake as well. But to see a 101-year-old gentleman get released from the hospital is quite an accomplishment for him and the staff here at Lehigh Valley Health Network.
The outpouring of support from the community is pretty amazing. You get into medicine with the hope of helping people, and you feel like you hopefully help someone every day. But the appreciation of that, my neighbors coming out with signs, people donating food, and just the phenomenal respect we've received for doing our jobs. We feel it's doing our jobs, but people appreciate that. They understand we're putting ourselves at risk. So that's the nicest thing that's really happened through this epidemic for us.
Help is just a click away. Visit PoconoMountains.com/COVID-19. That's PoconoMountains.com/COVID-19.
You are watching BRC 13.
Welcome to the News 13 Coronavirus